note, we would like now to move on to have a keynote address on a policy perspective on addressing intimate partner violence as a public health and human rights issue. And we are honored to have Dr. Christine Ondoa, the Director General, Uganda AIDS Commission. Dr. Christine Ondoa is the Director General of the Uganda AIDS Commission. She commenced, I would ask her to come please forward. She commenced her duties in February this year, following her presidential appointment to the office. Uganda AIDS Commission coordinates all work of HIV and AIDS, and now also with the Global Fund, we're having TB and malaria being part of these aspects. So Dr. Ondoa brings with her a rich academic background, plus a wealth of experience in medicine, health, policy design and implementation, public health service delivery, program administration and management, in addition to advocacy and leadership skills. She's a very, very good advocacy person. She has served in key regional, national and international positions. Before her appointment to the Uganda AIDS Commission, she was the Minister of Health from 2011 to 2013, Minister of Health for the Republic of Uganda, not Minister of Health for East Africa, so I don't want to get her into trouble. She later served as a Senior Presidential Advisor to His Excellency the President of Uganda on public health issues, besides serving as a board member of the Global Alliance for Vaccines and Immunization. So she comes as a keynote address speaker. She comes highly recommended and highly placed. Christine, welcome, and please, it's your turn to speak to the members.
Good morning. That was a loaded introduction. I hope my keynote address equally matches it. Distinguished ladies and gentlemen, all protocol observed. Good morning. I will take this opportunity to welcome each and every one of you to the Pearl of Africa, Uganda, especially my friends from the United States, from Kenya, Tanzania, from all over Africa. You are most welcome. I also take this opportunity to thank the organizers of this workshop for inviting me to have this keynote address of today. I don't have a PowerPoint presentation. I'll just read from my notes. I am also aware that this meeting has scientists and researchers who have up-to-date data and research the data that is going to be shared today and tomorrow. So I have just gathered a few of what I can, and mindful that we'll have more data from the researchers and scientists coming in later in the day as we discuss. Our government aims at improving the welfare of her citizens, especially by making policies and regulations which have been informed by research findings and also by the UNAS and other research institutions. We like to base this, the policies that we make with well-researched data and also being advised by the Academies. As Minister of Health from 2011 to 2013, I involved the Institute and the Uganda Academies very, very much, especially in vaccines and immunization. And I'm happy to report that their advice and their collaboration with the Ministry of Health yielded very, very positive results. Many of you may know in 2011 and before, our immunization in this country had very, very appalling indices. Our coverage was only 42%, and we had more than 500,000 accumulated number of unimmunized children. But as we worked with UNAS and the Academies, their advice, their close collaborations, and putting in place many of the things they gave us forth, today I'm happy to announce that our immunization coverage has gone up to, initially it went up to 97%, but yesterday I was informed by the Director General of the Health Services that it's now at 104%. So thank you very much for your input and for collaborating with us. And this therefore makes me confident that the overall objective of this workshop, which is to inform, to create synergies within a diverse community of researchers, implementers, and decision makers, promoting violence prevention, efforts that are evidence-informed, innovative, and cross-setting will be achieved in this meeting. As already shared, the World Health Organization defines intimate partner violence as behavior by a current or former intimate partner or ex-partner that causes physical, sexual, or psychological harm, including physical aggression, sexual coercion, and psychological abuse, and a controlling behavior. As we are well aware, IPV is recognized as a global human right and public health issue. And I know in this meeting, as we deliberate and discuss many issues, we'll be able to bring out that very, very clearly. Similarly, a growing evidence base is demonstrating that interaction of IPV and HIV infection, including significant overlap in prevalence, as well as increased risk behavior and barrier to testing as a result of experiences or fear of intimate partner violence is evident. In Uganda, gender-based violence, such as rape, defilement, and others, top up the list among the drivers of HIV epidemic. This is made worse by other risk behavior factors such as alcohol and substance abuse. The population-based survey indicates that 62% of women aged 15 to 49 years have experienced physical and sexual violence by any perpetrator in their lifetime. This is from the Uganda Demographic Health Survey of 2011. And this year, as we do our census, I'm sure we will have recent data that will update this one. Also, a recent longitudinal study conducted in Rakai, which is one of our districts in the southwestern part of this country, shows that women aged 15 to 49 years who have ever experienced intimate partner violence were 1.6 times more likely to subsequently acquire HIV than those who may not have been abused or experienced intimate partner violence. This is a study by Kohan Jinjan in 2013. There's also recent data by the Start Awareness, Support and Action, commonly referred to as SASA, SASA, is a community mobilization approach developed by the Raising Voices and implemented by one of our community partners. The project encourages communities to reflect on gender norms, roles, and power relations by encouraging dialogue on different dimensions of power. This is really mainly to encourage that gender violence, gender-based sexual violence is prevented. And it was aimed at saying, if we prevented this, what will be the impact on HIV and other related issues? The recent evaluation last year in 2013 then showed that the project reduced intimate partner violence by 18% and a community reduction in HIV equally of 36%. That means if you reduce IPV by 18%, then HIV is reduced by 36%. Half the number. I think this is worth putting our implementations and policies in place. There are other factors that contribute to fueling of the HIV epidemics in our country, especially the human rights violation for younger women or girls, and this also from our HIV sero survey of 2011 came out very, very prominently as one of those factors that fuel our epidemic. This is because oftentimes access to justice is difficult for the women and for the young girls, coupled with our weak enforcement of the existing laws. Notably, stigma and discrimination are also closely associated with both intimate partner violence and HIV infection. Other associated consequences of IVP are seen on the children. We see a number of children drop out of school. We see them also becoming more violent. They are engaged in sexual abuse, substance abuse, and also are registered in more heading of the school strikes, heading of other violences in schools have been registered. And this is seen more, about fourfold more in children who have seen their parents gone through gender-based violence or other abuses at home. I was looking at one of our national newspapers today called the Daily Monitor. On page 22 and 23, talks of the effects of child molestation, effects of abuse. I want to just read a few of the quotes to also make our delegates know that this is something that is very often here, and it is that being addressed and being raised. The African Network for the Prevention and Protection Against Child Abuse and Neglect, ANPCAN, Uganda chapter, is equally concerned about the increase in cases of defilement, of sexual abuse, of violence in the country. The national statistics as per the 2013 police crime report indicate that 9,598 children were defiled that year, a figure that tallies with the ANPCAN information collection. On the previous page, on the next page, a mother narrates her story of how her daughter was defiled several times with an HIV positive person who was actually known in the village, and later after the defilement, she was found to be HIV positive. And the statistics continues. One of the reporters says, defilement comes with terrible effects, and which are physical, social, and psychological. And in their research and study, they also agree that apart from the physical and psychological and social effects, the abused persons get sexually transmitted infections, urinary tract infections, and others HIV infections. Sometimes when the victims who are abused are younger, they get effects that are far beyond the current it goes on way into their future lives, because some of them have been found to have their sexual reproductive organs damaged as a result of the abusive sexual violence. Many times the defilement and the abuses are actually committed by people they trust, hence betraying their trust and making them hate people of that same sex. Even when one is married, it affects them, and it could take them ages to trust the male person. And some of the girls says, the worrying outcome, according to the reporter, says that 90% of the girls who are abused keep quiet and never share this with anyone as long as they have not conceived. And this could lead to severe depression. They later get panic attacks when they remember what happened to them. And sometimes they get sick, and then people think that they have been either bewitched or have other psychological or mental illness. So it goes on and on, but I just wanted to bring this to the attention of the delegates, that the effects are far-reaching, and as I indicated earlier in the statistics, HIV and IVP are very, very closely linked, especially with the statistics that we have in our country. So therefore, addressing IPV will go a long way in solving many of the issues and complications, including new HIV infections, including reducing discrimination, including reducing the deaths associated with HIV and gender-based violence. I want to take this opportunity once again to thank the organizers, and I pray that our meeting today and our discussions brings a lot of many rich experiences and researches from the other partners that we can all together share. Thank you very much.